Okay, this is a quick demonstration of assessing for tone. This could be rigidity or spasticity. The important principles are that the person is relaxed and allowing you to passively move their limb. It may be awkward for an individual to let you move them. A lot of times they try to help you move, and then you can perceive some resistance intermittently as you're trying to move them. Just cue them to relax and let you move them. If you're looking for spasticity, you need to go fast and slow and compare the two. If you're looking for rigidity, you're testing throughout the range in both directions, so the distribution of changes might be a little bit different. You should always make sure you're familiar with what their available range is and make sure that you're testing within that range. So I'm just going to show you a nice way to handle the limb so that you can support it and move in multiple directions without having to jump around on their arm a whole lot. And you can do the same thing in sitting. It's just easier sometimes for people to relax in supine and easier to get their arm, particularly their shoulder motion, when you're looking for spasticity. So I tend to put my index finger in the palm of their hand and then use the rest of my fingers to support the wrist. So I have the thumb on the dorsum of the wrist to try to stretch the wrist and finger flexors into extension. And then I can also push down into flexion to test the extensors for spasticity. So for me, this is a nice hand hold. And then my other hand is under the elbow, so that arm is using its efforts to try to test the shoulder. So the hand at the patient's hand, I can use at the elbow. I can use it at the wrist. I can get fingers if I need to, fingers if I'm trying to look at or appreciate spasticity. And then at the shoulder, again, I'm doing some passive range to start with, making sure that I understand what range is available. Then I'm going to give a quick stretch. So sometimes it's letting the weight of the arm drop. Sometimes it's a quick stretch for triceps, quick stretch for biceps, back and forth a little unexpectedly. And again, I can get flexion and extension of the wrist. I can also look at pronation and supination, which may be affected in the forearm or with the biceps. So for me, I'm trying to be unpredictable, looking across the joints and being mindful of which muscle I'm stretching as I'm doing my quick stretches, okay? So that becomes a challenge when it comes time to document. If you perceive resistance, it's important to think about which muscle is resisting you. Is it the flexors or is it the extensors? And it depends on the motion that you're doing when you detect that little bit of resistance.